Deep brain stimulation of the amygdala and pharmaceutical treatment, which is best preferred for treating anxiety, a proposed study by Christina Maddox. Some background. Anxiety is defined as intense, excessive, and persistent worry and fear about everyday situations. Anxiety disorder is the most common of all mental health problems worldwide, with 18.1% of adults in the United States affected. Anxiety can cause one to act out in a specific setting. The goals and hypothesis of this current study is to understand the effects of deep brain stimulation of the amygdala and pharmaceutical treatments for anxiety and which as a result is more effective. It is hypothesized that deep brain stimulation of the amygdala will have a higher effect than pharmaceutical treatments in treating anxiety. Pharmacological treatments for anxiety disorders have become more tolerable, available, and numerous over time. Despite the changes, between 1/3 and 1/2 of patients on a modern antidepressant do not achieve sustained remission from anxiety. Deep brain stimulation is a treatment for neurological and psychiatric disorders, in which electrical pulses are delivered to specific brain areas through implanted electrodes and a pulse generator. Now, the amygdala plays a critical role within a network that regulates emotion. The amygdala is known as a center of fear and anger, and with deep brain stimulation, it is a promising treatment for mood disorders because it sends implantable electrodes to stimulate those areas of the brain. It has been tested as a method to be applied in patients who do not improve with traditional measures, such as pharmacological treatments. The participants of this study will be a predicted convenience sample of 87 participants, who will be recruited throughout the community of a historically Black college and university, an HBCU. The participants will be staff, faculty, and students. Students will be predominantly undergraduates. The participants will be selected based on their history with anxiety or stress, or are they currently diagnosed with anxiety, stress, or depression, and have received, currently taking, or seeking treatment for those mood disorders. For the design of this study, a quasi-experimental design will be used to determine if deep brain stimulation is a better form of treatment than pharmaceutical methods in the treatment of anxiety. Participants are separated into two groups based off of type of treatment: pharmaceuticals or deep brain stimulation. Participants will use surveys to describe the severity of their anxiety and its symptoms and record diary entries after the method of treatment has been issued or is currently being used, and the relationship between the two will be determined. How is the procedure done, you ask? Well, participants will be recruited throughout a private college campus and asked to participate in questions regarding their previous history or current diagnosis of anxiety. After providing consent, each participant will be informed that their responses and participation would remain anonymous in order to protect the identity of the participant. Participants, if receiving pharmaceuticals as treatment, will record a diary daily for 14 days and log their symptoms of anxiety throughout their treatment. To meet the criteria for deep brain stimulation, patients will be eligible if over the age of 20 and had received a previous medical diagnosis of anxiety mood disorder. An implantable pulse generator, IPG for short, and implantable electrodes will be used for an electrical stimulation operation, with the patient awake and under local anesthesia. For the materials of this study are an implantable pulse generator, an IPG, for deep brain stimulation. So, a neurostimulator, a battery-powered microelectronic device implanted into the body to deliver electrical stimulation to the nervous system. This will be used for stimulation in the brain due to electrical impulses to help in treatment of anxiety. The Hamilton Anxiety Rating Scale. This scale is used to measure the severity of anxiety using the symptoms. Self-reports from participants will be recorded based off of treatment being received, so deep brain stimulation or pharmaceutical treatments, and the resulting symptoms of anxiety they are feeling afterwards. The scale consists of a total of 14 items, each question ranging from 0 to non-persistent to 4, very severe. For future research, we are not acknowledging any third-party factors in participant lives, such as sudden close death, layoff of job, bankruptcy, that could have an impact on why there is no increase or change in their anxiety and mood disorder. So this could have an effect on why deep brain stimulation would not be a better outcome in treating anxiety than pharmaceuticals. Also, for future research, participants should be given a task after treatment to see if things such as physical activity have another effect in the decrease of anxiety after the treatment methods. Well, thank you for listening.